Okay, yeah, let's just admit everybody, please.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Good morning, everyone. Lovely to see you, and welcome once again to CATHIP's Health Hour. I'm Dr. Vanessa Appiah, and I'm your host for today. And as ever, I'm welcoming all our regular listeners and also welcoming those who are spending time with us for the first time. I always say this, but we don't take your time lightly. So thank you so much for choosing to spend your busy Saturday mornings with us. So just before we launch into today's session, just wanted to give you a bit of an overview of who we are and how we've come together. We've had a bit of it in the video, but this health hour is brought to you by CATHIP, and CATHIP is the Caribbean and African Targeted Health Improvement Program. And this is a collaborative, educative, empowering health literacy program that is really designed to reach people where they are able to then take control of their health and really to support themselves and others. And it is put together by a fantastic partnership. I'm biased, but they are fantastic. So we have the Caribbean and African Health Network, we have the Black Health Initiative, we have the Royal Assembly Redeemed Christian Church of God, we have RAFA International Development Agency, Croydon BME Forum and Enfield Caribbean Association. So all of these organizations have come together to really bring a program that we feel is right for you. But as ever, this is a partnership amongst the organizations, but a partnership with the community. So please, 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 this is for you. If you have any feedback, comments, there are topics that you want us to cover, please contact us. We'll put the details in the chat. This is a space in which you are learning, in which your network and family are learning. So we really want to bring what you need to the forefront. As I always say, it is for you. And so in the chat, please, it'd be really great actually if you could put your name or your or where you're speaking from, where you're watching from, if you're watching by yourself, if you're watching in a group. It's always great to know who's here with us every Saturday. So we have a fantastic session for you today, and I think that I always say every time there's a session that I'm hosting, it's always really directly relevant to me. And today we have the wonderful Dr. Joe, who is a regular on here, who comes and supports the Health Hour regularly. And he's going to be talking about headaches and really, is it a headache or is it a migraine? And I'm sure there are many people on here who, have had a headache in their lifetime, but also have gone to that space where they're querying, it's so intense, is it a migraine? Do I need to be doing something else? So we have the fantastic Dr. Joe with us, who's going to be helping us walk through that. So I'm just gonna hand over in a second, but just reminding you, the chat is there for questions. So please interact, put your questions in there. I will do my best to collate all the questions. So at the end, we can have our really enjoyable question and answer session. And also, if you're happy to, at the end, I'll be asking you to put your hand up. And if you're happy to just come on screen, or you don't have to come on screen, but you can unmute yourself and ask your question directly. So without further ado, I'm going to be handing over to Dr. Joe. Dr. Joe, lovely to see you as always.
Good morning, Vanessa. Hi, thank you. Thank you as always. Thank you for hosting that very well. Good morning, everybody. I hope you're enjoying sunshine where you are. We always like to think it's sunny in Manchester. Even when it rains, we like to think it's sunny. So I always say, welcome to sunny Manchester. I hope this meets you well today. Like Vanessa said, she and I are a group of doctors that volunteer to assist with the work that CAHN is doing to make sure that our communities are educated and are helped and are supported. And so just as a disclaimer, we don't have any vested interest. I'm not representing any drug company or anything like that. And indeed, I'm not being paid. Vanessa, maybe we should discuss about that. Get paid in Ghanaian jollof rice.
With kebab, don't forget, with kebab, not just the rice.
So today we have a very important subject. And so I'm going to try as much as possible to bring this down to digestible level, because talking about headaches, we could write a whole book on headaches. And like I always like to say, the aim of these talks really is to make sure that we have something to take home, something that we can make use of, something that is relevant on a day-to-day basis. So I'm not going to try and bamboozle you with a lot of medical knowledge. I am a registered general practitioner. I have special interest in mental health. I do have other special interests. I have a diploma in sexual and reproductive health as well. Most people don't know that. I am a trained coach, an internationally trained coach and speaker. I mentor young people. I wear many hats, but I'm home. I'm just a dad and the guy that takes out the bed. Right. So let's delve into this very quickly. I'm going to try. Let me see if I can share my slides. Good. So we'll move quite slowly because the aim really, like I said, is to foster understanding. All right. So the topic that I've been asked to talk about is on...
Sorry to interrupt, Dr. Joe. It's not on... Oh, perfect. There we go.
It is on tension headaches versus migraines. So you can either call it migraines like the Americans do, or migraines, which is the typical British pronunciation. Migraines come from a Latin and Greek word. That's why the French call it migraine. I'm not French, but I like migraines. I think it's much easier to pronounce. So that's me. Like I said, I have all these letters after my name and all of that. Let's delve into it. I thought it might be important to just talk about headaches in general to start off with, all right? I think every clinician, anybody will agree that for us, if general public are not aware, making a diagnosis for headaches can be quite challenging, because sometimes You don't know whether it's a serious one or if it's just a normal headache. Or so even amongst medicals, when I teach medical students, one of my many hats, medical students are always afraid, medical practitioners are afraid because you don't want to get it wrong. All right. So I said, though headaches are quite common, the real challenge for me, for us as a clinician, is to distinguish between a simple debilitating condition, in other words, a condition that will bug your life, make your life miserable, as opposed to something that's life-altering. And there are headaches that can be life-altering. So I thought I'd sort of put that out there. Both tension headaches and migraines or migraines that I've been asked to talk about today are primary forms of headache disorder. There are other forms of primary headache disorders, cluster headaches, premenstrual tension type headaches, and all sort of things. Now, headaches are broadly divided into two classes. You have primary and secondary. When we talk about primary headaches, that means there isn't anything outside of the headache that is causing it. Whereas secondary headaches are often caused by something else, brain tumors, brain bleeds, or sinus congestion, things like that. If I'm speaking too quickly, let me know. So here's the thing. I want to do a few case studies because, like I said, I like to marinate on this so that even if we don't complete the subject today, we can come back another day and just try and, sort of go on it. But I want to give you some case scenarios that hopefully would help us to understand different types of headaches and sort of the things to look out for. Because I don't want to bore you with all the facts and figures and numbers and things, most of which you probably not remember. So for the sake of this presentation, this chap is called Benson, not his real name. All these are actually my patients, all these examples. I've changed their names, I've changed their ages around, but yeah, they're all real people. Okay, that's a stock image. I don't know who the guy is. Okay, so Benson is 66 years old. He's Afro-Caribbean, as you can see. He's had a few falls, but often recovers quite quickly. Daughter has observed that he can be unsteady on his feet sometimes. Unfortunately, I said unfortunately, some people might think it's fortunately, he does like to have a drink sometimes. I mean, an alcoholic drink. In the last few weeks, he's continued to have, about 3 weeks, he had a continuous dull, throbbing headache to the back of his head and to his sides. He had forgotten that he fell when he spoke to his GP, so he didn't mention anything. He spoke to the GP about it, they gave him paracetamol and ibuprofen and sent him on his merry way. Unfortunately, a couple of weeks later, he began to have seizures and was rushed to the hospital. When he had a brain scan, they showed that he actually had a bleed, something called subdural hematoma or extradural hematoma. So it was outside. So the brain has different layers. You have inside the brain, you have a covering of the brain, and you have the outside. So subdural or extradural hematomas can be caused by chronic tiny bleeds, often due to people who have had a few falls, often as a result of alcohol. It can happen at any age, but obviously it's much more common as people grow older. Margaret, the 55-year-old lady, she suffers with hypertension, smoked in her youth, no longer smoking now, and is a social drinker, so she's not a big drinker or anything like that. She woke up one day with what she called a thunderclap headache. She said she's had headaches before, but this was the worst headache ever. Now, one of the things that we do, one of our jobs as clinicians, is to listen to what the patient is telling you. And sometimes, we often have difficulty with people when people can't describe, or people think they're helping the doctor and they over-exaggerate their symptoms. Please don't do that. Just tell us exactly what we're asking, because every question that we ask is helping us to go in one direction or the other. And in particular, for headaches, this couldn't be more important. One of the things I always ask patients is this the worst headache you've ever had? And for some of us who are a bit dramatic, we say, yes, it's the worst headache we've ever had. But by the time we ask a few things, well, you've not bothered to take paracetamol. You've not bothered to take ibuprofen. It couldn't have been that bad. All right, enough said about that. So she woke up with this thunderclap headache, worst headache she's ever had. Steve, her husband, drove her to the A&E despite her protests. She was a university lecturer, or he's a university lecturer. She said, oh, it's fine, there's nothing wrong with me. It's just a headache, it will pass. I'll just drink some water. Unknown to her, she had suffered a bleed in her brain called a subarachnoid hemorrhage. Subarachnoid hemorrhages account for up to 5% of strokes. It's more common in Black people, more common in Black women. Also occurs between the ages of 40 and 60. If you don't take anything away from today's presentation, is if you have a headache that is persisting beyond 4 weeks, please do not ignore it. I'll say that again. If you don't hear anything at all today, if you have a headache that is persisting beyond 4 to 6 weeks, please go and see a healthcare professional. That's what we're there for. And if we can't make head or tail of it, we'll either send you for imaging if you're in a locality where you can get imaging, because up until 5, 6 years ago, I think, maybe 10 years ago, GPs couldn't organize MRI scans. I think quite recently in the last 5 or 6 years, now we can organize MRI scans and only for the brain, not for anything else. So sometimes you go to your doctor and the doctors also have their own limitations. But the point is, please do not minimize your symptoms. If you've had a headache that's not going away, please seek professional attention and you'll see why as we go along. She suffered a brain bleed. Fortunately for her, she was seeing at Salford Royal. She had an operation and she's absolutely fine. Not many people are as lucky as her. Epiphany, quite like that name. 36-year-old mother of 2, not her real name. For the last 6 months, she developed a headache which has slowly become worse. These kind of headaches are often very insidious. In other words, they don't really cause you a lot of trouble. They just come and they disturb your life, but they don't cripple you or anything like that. But when we delved further, apparently she's had the headache for years, but she never, in the last 6 months, it became slowly worse. She's never smoked. She likes to be active, but after a while, she began to notice subtle changes in her vision. And although she wasn't breastfeeding anymore, she discovered that she was producing some milk. So when she suddenly developed double vision, she called her doctor for advice. She was surprised when the doctor panicked and sent her to the emergency department. Now, when your doctor panics, you know that there's a problem because doctors often never panic. Most of the time, actually, some of my colleagues, some people accuse us of being a little bit nonchalant. But when a doctor is worried, you should be very worried. It turns out when she had an MRI scan that she had a very slow-growing brain tumor called a pituitary adenoma. Pituitary adenomas are not cancerous. I've deliberately avoided cancers because it's a totally different subject and it's a different ballgame when you talk about brain cancers. So I'm not going there. Pituitary adenomas are often very benign. The problem they have is that they grow and grow and grow, but they don't cause you any problems until they begin to get so big that they cause pressure symptoms. And that's what happened with this particular lovely, lovely woman. She had an operation, or she had, I think in this particular case, you have the option of hormone treatments and other treatment versus an operation. Can't remember what she had, but she's doing quite well on medication. This gentleman, who I choose to call Samson, is successful businessman, small business owner, never smoked, keeps fit, lives healthy, you know, good all-round good guy, you know. He had headaches on and off, but in the last 2 months.
Well, we'll see. Okay.
I'll take it.
All right. Thank you, Tony. Soon, can you please confirm?
Okay, so he never smoked, keeps fit, lives healthy. Last 2 months, he noticed that he's been having frontal headaches, which are on both sides of his head. All right. It felt like a tight band across his forehead, often not very severe, sometimes doesn't even need to take medication, but often sometimes relieved by simply resting. He didn't think anything of it unless he gets a very bad one. So from time to time, he'll get a bad headache. It didn't affect his day-to-day life. As usual, he didn't want to go to get checked, but his wife pushed and persuaded him because he was of that age. You know, he had turned 40. The GP made a diagnosis of tension headache, and he was started on medication. Now, he made some adjustments to his schedule, and the headaches were relieved. He's doing really well. Not everybody. I have another, well, I'll finish up with my examples. Because we wanted to talk about tension headaches, I thought let's just zero in on this and sort of try and have a quick chat about it. Please bear in mind that I'm kind of giving you a very broad overview of headaches. Like I said, headaches can be very complex. Headaches are very broad. There's a lot to be said for headaches, but we'll start having a conversation and see how we go from there. So tension headaches are the most common type of headache disorders. They are often mild to moderate in severity. So very often we ask you to grade the headache on a scale of 1 to 10, whereas 10 is the most severe. Most people who have a subarachnoid hemorrhage or something like that tend to talk about the headache being 10 over 10. And even things like a pituitary adenoma, which is benign, if it has grown big enough, it can cause a 10 over 10 headache. But tension headaches are often on both sides of the head. It feels almost like a tight band or pressure. It often doesn't have other symptoms like vomiting, nausea, no pins and needles. Now, in medicine, we say never, because sometimes you can have a mixture of things. You can have a mixture of both a tension headache and a migraine happening at the same time. But speaking classically of the individual symptoms, this is what we tend to find. Stress or psychological distress is often a precipitating factor. So people who run businesses, stress at work, not sleeping well, having young children, all sorts of anything at all that acts as an imbalance in your stress schedule can often precipitate a tension headache. And it's often frontal. It can be on any side, but it's often frontal. Interestingly, overuse of painkillers, so taking popping pills, paracetamol, ibuprofen, can also initiate or perpetuate the onset of tension headaches. So we have to be careful about that. What do we need to know about tension headache? There are other things that can mimic tension headaches. Cervical spondylosis, which is arthritis and wear and tear of the neck, can sometimes present like tension headaches. Ear infections. I've had a few cases of people who they had an ear infection and they thought it was a headache because it was throbbing on that side. But by the time we asked further questions and examined their ears, we found out that they actually had an ear infection and it wasn't, same thing with a toothache or dental abscess. Sinus congestions or sinus infections can do that. So you can see that quite a few things that people experience on a day-to-day basis can cause headaches or mimic some of these headaches. So it's really important that we don't minimize headaches. But if one thing we learned in physiology, I'll never forget in medical school, pain is often your body telling you that something is amiss. Pain is a signal, is a warning signal that all is not right. So for some of us who may have a very high pain threshold, or people who like to, you don't want to bother the doctor, please bother the doctors, because that's what the doctors are there for. That we're there to be bothered. Pain is not hardly ever normal, put it that way. So if there's pain, that means your body is telling you that, all is not well, and whatever it is needs to be looked at. But I think it's really important that we take home that, especially within the Afro-Caribbean community where there's a lot of underreporting, where we don't like to go to the doctors, where we sometimes feel that we're not heard. Please make your case known. There was a very tragic case of a young mom who was pregnant. She was actually pregnant for her third child. And it wasn't, it was just a sad state of events. She had been having headaches before she got pregnant. And she was now, all through her pregnancy, she was devastated. She was like totally wiped out with these headaches. Now, because she was pregnant, there were, there were things that were limited in terms of what we could give her. Immediately after she delivered, immediately after she delivered, they did a brain scan on her eventually, after nearly 2 years of complaining of headaches, and found out that she had a brain tumor. She had a brain tumor that had caused a bleed inside her brain. Sadly, she passed away a week later after delivering the baby, about a week after, because all the treatments were delayed and delayed and delayed because she was pregnant. But the truth of the matter is, she had been having headaches before she got pregnant. So if she had been checked out, we could have picked that up. Now, not everybody that has a headache needs to have a brain scan. Let me just put this down. This is why you need to speak to a health professional. On my own part, If you have had a headache for more than 4 to 6 weeks, and we've given you steps, things like, and I'll talk about that when we talk about treatment in a minute. Maybe we should just do that. So other things that can sort of mimic tension headaches, raised intracranial pressure, subarachnoid hemorrhages like we talked about, and obviously brain tumors, depression, headaches, etc. So in terms of investigating this, like I said, when we are asking you questions about headaches, what we want to know is how often do they occur? Do they happen with exercise? Do they happen with food? Do they happen around your period? So there are certain things. There's something we call the headache diary. We give you a sheet of paper where you fill in daily observations of your headaches for 4 weeks. This is approved by the Headache Society, International Headache Society. All the articles are there if you want to go and check them out. You follow the headache diary, and that gives us an idea, because headaches, like I said, can be incredibly difficult to make a diagnosis of. So we don't ever downplay it. We want to know whether we can reassure ourselves, is this a simple tension headache? When I mean simple, I mean it's not going to kill you. I've not met anybody in 30 years of being a practitioner, including medical school, that had ever died from a tension headache. Not one. You can die from, a road traffic accident or lightning hitting your house. Very unlikely to die from a tension headache. But it's important for us to make that distinguishing factor and to be able to reassure ourselves. Very often, if the headache is persisting or your symptoms are debilitating, in other words, it affects your ability to be able to go to work, live a normal life, go out and just have fun or have a drink, if you're the type that wants to have a drink. If the headache is enough to challenge your day-to-day activities, then I always offer people a scan. The problem with that is that we don't want to scan everybody, because MRI scans are not without their own, pitfalls. The amount of radiation you're exposed to and things like that is also a factor, especially in younger patients. So if you're under 25 or under 20, very often we will very, very unlikely, we will not want to scan you because the effects of the radiation can be worse for you. But those are things that we have to balance. We have to try and weigh what works best, in those circumstances. So in terms of treatment modalities, like a treatment plan, if you like, avoid overwork and stress. Easier said than done if you live in Manchester or indeed in the UK. Avoid overwork and stress. Avoid excess alcohol. A lack of exercise. So tension headaches are often more seen in sedentary people who sit down for a living. If you see the number 1 beside it, that's where the evidence is coming from. I use the Cochrane Library, GP Notebook, and things like that. And they always have references for where all this research, because what we do here in the UK is what is called evidence-based practice. And that's why in another 10 years, we may have further evidence or more information. And somebody will say, well, you medical practitioners are always changing your minds. No, we're not. We're always improving the health treatments based on current research. And I think that's the way it should be. The knowledge that I gained 23 years ago when I finished medical school, things have moved on. Things have moved on. The kind of instruments we used back then are no longer used or seen today. So clinical depression should be treated as well. Avoid overusing painkillers. Some people just like to pop pills for everything. Sometimes simple dehydration is what's causing the headache, and you need to drink a little bit more. Keeping a headache diary can be helpful in the diagnosis. Physiotherapy, especially for musculoskeletal symptoms, so neck massages, head massages, mobilization, manipulation of posture, your shoulders. Then there are other things like strategies to counteract stress, lifestyle changes, relaxation therapy, drink lots of fluid, etc. Put your questions in the comment boxes so that we can have a conversation. If you have something that's burning as we go along, please put your questions in and we can answer them. We have Vanessa here who knows everything about everything, and she'll hopefully help us with all the information that we need. So my 5th case study, I think the 5th one, is a young lady that I call Hansatu. Hansatu is a 30-year-old school teacher, not her real name. She feels like she's had a headache all her life. This is typically just exactly what she said. usually one-sided, usually in her case on the left. It often came with some sort of warning, flashing lights, feeling sick, tired, or dizziness. So when this happens, she often has to lie in a dark room, ranging from 2 to 3 hours, almost to the whole day, sometimes for up to 3 days. But what she observed is that very often it resolves as dramatically as it started. Or sometimes she gets to need painkillers. Very, very poignantly, her mom also used to complain of headaches. More recently, she's been getting these headaches as she gets more and more older. Brain scan done by a GP was normal. Headache diary confirmed that it was brought about by certain foods and activities. She was started on migraine prevention tablets, and in her own words, her life was transformed completely. This is a typical picture for migraines. This is what happens with migraines. All right. So what are migraines? They're the second most common type of headache disorder, often characterized by 4 stages: prodromes, auras, headaches, and then it resolves. So prodromes are things that you feel like, you sort of feel lightheaded, you feel tired, you feel like there's something coming on, like I'm not feeling too well, just general malaise, just not quite right. Then the aura, not everybody gets an aura, by the way. The aura could be flashing lights, it could be sort of double vision, it could be sudden vision. There's lots of different things because you have different classifications of migraine. This is why I said we're just skimming on the surface. Migraines themselves can be divided into all sorts of different things: hemiplegic migraines, focal migraines, optic migraines. There are different types. I'm not going to trouble you with all those different things because we could be here all day and still not finish. But some types there's migraine with aura and there's migraine without aura. The classical migraine often comes with an aura, flashing lights, blind spots, things like that. Then you get the headache itself. So the prodrome is maybe in the morning you sort of feel, tired. Then by late afternoon, you start seeing dark spots in your visual space, or flashing lights for some people, zigzag lines. Then the headache comes on. And then you need to go somewhere dark or you need to go somewhere quiet. It can be quite debilitating. It has caused a lot of days of school, because it can start as early as in teenage years. That's another thing I wanted to say. Starts early, and then, like I said, often starts in childhood. And then, but the peak period is between 30 and 40 years old. After 50, it's almost rare, unusual to find people still suffering with migraines. If they're still having migraines over the age of 50, you need to be careful about that and check it. Very often it may not be a migraine, it may be a tension headache, or even a cluster headache, or a sinus headache. But if somebody comes to us, or if you are a person and you develop new regular headaches over the age of 50, please, that is a red flag. You need to get that checked out sooner rather than later, because migraines don't happen hardly ever. There's no never in medicine, because you do get the odd people who like to be awkward and make our work more difficult as doctors, and very often they are not Man United fans. I'll tell you that for sure. But you do have people who don't sit within the regular thing that we want. I had to add it in there, and I hope City wins later today, by the way, even though we are full-blooded red. So, they don't fall within that category. So you have to be careful. When you start to see headaches in 50s and 60s, we often get very worried about that. They are the people that we get them to do a scan as soon as possible, because having these funny sort of migraines around this age, very unusual. Not unheard of. It's not impossible, but we have to be more careful with them. So migraines are often associated with an increased risk of strokes for smokers or for those who use the contraceptive pill. Very important, because the ratio of female to male in terms of migraines is 3-to-1. So, females suffer more with migraines than with male. And very often it tends to run in families, like in the example that I gave you, the Hansatsu lady. It was in her mother. She's 30 odd years old. It's one-sided headache. She's lost a few days of school. She often has this aura, this thing that comes along, all right? But by 50, 60, like I said, it starts to resolve. So these are salient things that we can observe. Points to note, migraine is often an inherited tendency to headache, which can be treated but not cured. So is an inherited tendency to a headache, which can be treated but not cured. So far, we don't have a cure for migraines. Putting it out, we can help you manage it, because the aim actually of migraines is A, we want to stop the suffering. We want to reduce the pain. We want to reduce the inconvenience that is causing you. B, we want to reduce the frequency and the intensity of the headaches. We want to reduce how often you get it. We want to reduce how bad it is. We're not aiming to try and stop it. So if you get a migraine sufferer and you can get them to the point where they have a migraine every 2 years or every 18 months, that would be considered to be a success in our books. Now, to the patient, they might think, well, I've come to the doctor, because if you don't educate them and say, look, we're not going to cure, it's like eczema, people have a rash or allergic type rash, correct? And they want you to give them a cream that will get rid of it completely. It's not going to happen, because we don't have a cure for this yet. You may go and pray to your gods and they may cure you. But as far as medicine are concerned, we don't have a cure yet. So with the exception of women who smoke or who take the oral contraceptive pill, there is no significant association with serious risk. But we have said that migraines can cause strokes, especially for people who smoke and for those women who may be taking the oral contraceptive pill. Often the treatment takes time. So migraine prophylaxis, when we get into it, if we do get into it, you find that there are many treatment modalities for that. So migraine prophylaxis, we often do it over a space of 3 months or so and try it after we've done the headache diary. There are many different types of medications that we use for migraine prophylaxis. It's a very good one, propranolol. It's a beta blocker. We tend to start on a low dose and sort of graduate to pyramate, even other things like that. There are other amitriptyline and carbamazepine. There's medication. There are other general measures, the lifestyle, good sleep hygiene, work-life balance, reducing stress and things like that. Obviously, managing the acute attack of migraines. There are drugs called triptans, sumatriptan, the one that go through the nose, or, so you can even have migraine relief and things like that. But the aim for us as health professionals, we want to reduce the amount of headaches you get. We want to reduce the intensity of these headaches. We also want to give you a better quality of life. In other words, if we can't cure the headache, at least be able to live your life quite successfully. Now, this slide doesn't quite small, but I've tried to just give you a snapshot, as it were, of major differences between migraines and tension headaches. All right, so migraines can be throbbing, unilateral type of head pain, whereas tension headaches often feel like a band or a squashing, like pressure, and it's often on both sides. Migraines are worse with movements in the head. Tension headaches often are not worse, whether you move your head or not. Almost all of us here will have experienced tension headaches at one point in time or the other. With migraines, you can have nausea and vomiting. You can have, sensitivity to light, etc. And this is where, again, seeing a health professional is very important, because sensitivity to light and a headache, especially in young children, could be a sign of meningitis, where there's an inflammation in the brain or an infection. So speaking to a good health practitioner, taking a good bit of history, sort of like foreign travel, things like that. If you've been to sub-Saharan Africa or in those kind of climates where meningitis is prevalent, can be very, very crucial. So it's really important, if you've not had anything today, please do not ignore a persisting headache, especially if it goes beyond 4 weeks, 6 weeks, and you're constantly getting a headache. Do not ignore it. With tension headaches, you don't get all that. There's no drama with it. There's no nausea, vomiting, etc. I get tension headaches from time to time, partly because I don't drink enough water. I'm trying to correct that myself, or sometimes it's just the busyness of life and things like that. Or when Man United are not winning, that often gives me headaches as well. So in terms of migraines, you also have trigger factors such as bright lights, change in weather, menstruation, alcohol, poor sleep, skipping meals, stress, etc. Whereas tension headaches are mainly due to psychological stress. If you remember the example we gave about the business owner, that's a typical example. Doesn't have to be a business owner. I've seen classroom teachers, chefs, traffic wardens, policemen, policewomen, nurses, doctors. Anything at all that causes that imbalance in your psychological structure can cause a tension headache. But it's really important that we distinguish them. All right. Thank you very much. That is my quick spiel on headaches for now. And let's see if we have a few minutes to take some questions so I can go and have my pina colada.
Dr. Joe, thank you so much. As ever, you've distilled some complex concepts really simply. And I think, as ever as well, we have a number of questions coming through. And please, everyone, we've said it before, this is for you. You've digested some of what Dr. Joe has said, and this is a time to really drill him and see if there's anything that you need to clarify or give you some more guidance. So I'm going to go through some of the questions in the chat. As I said, please feel free to put up your hand. We'll keep an eye on that. If you'd like to speak, unmute. If you'd like to put your camera on to speak directly, that's all fantastic. So just thinking about one of the first questions is about traditional medicine and supporting migraines and headaches. I like your smile. And so someone on the call is using one of the medications, sumatriptan, for migraines, but has also just mentioned about herbal nasal drops and do they help? So just to get your perspective on things would be great.
Thank you, Vanessa. So I have, you caught me on my smile. I have a thing about herbal medicine. One of the reasons why we don't prescribe herbal medicine yet on the NHS, and I use yet, because there's parts in Thailand and parts of the US where herbal medicine is actually prescribed by healthcare practitioners, but not here in the UK. One of the reasons why we don't do that is because you cannot guarantee the ingredients in the herbal medicine. So it depends on what sort of herbal medicine you have. So speaking strictly, like my lawyer friends will say, strictus sensus, we do not advise you to use herbal medicine for migraine. Why? Because we don't know what's in it. Case in study, I had a patient who suffered with a chronic condition. This was back in Nigeria. I was a young doctor back then. This is many years ago. I don't think anybody has described me as young in a while. Now, unfortunately, they used herbal medicine and the guy developed liver failure from the herbal medicine. And the family were distraught because he was getting better. I'm not saying all herbal medicine is bad, but you have to be careful what you're ingesting because you don't know what's in it. So for me, combining herbal medicine with triptans is risky because you don't know what's triptans are not commonplace everyday drugs. They are drugs that are on specialist advice mainly, and for a very specific condition. So I would strongly advise you not to do that because you don't know what side effect. The herbal medicine may be fine in itself. The triptans are fine in themselves. By the time you combine the two, don't forget these are chemicals. By the time you combine them, the Chinese are actually very good at this because they combine different things and they create cures, but they also combine different things and they create poisons. So you have to be careful what you put in it. So that would be my answer to that question.
Great, thank you. I think a really balanced answer, and I'm sure there are many people on here who may have seek herbal medication rather, so really helpful advice. And you noted that you could speak for hours about headaches and go into the different details about the different types of headaches more than you went into earlier. And there's one type of headache that someone's just brought up, so I thought it would be a good opportunity. So it's about TMD, so temporomandibular dysfunction, and saying, what's your experience of those related headaches?
So the temporomandibular joint is right here. Okay, for those who don't know. So they are called TMJ disorders, or TMJ problems for short, or because it's a long name. Now, well, I've had a few patients with that. One of my jobs in my long walk so far in the NHS is to have worked in ENT. So we actually saw quite a few TMJ problems. It can be quite, like I said, you can have other conditions that mimic. It's a form of secondary headaches. Once it's actually has been found that there's a little bit of arthritis in the TMJ that then causes that disorder. But unfortunately, all the nerves here are all connected to the nerves here. So when you have a TMJ problem, it may feel like a throbbing, a migraine on that side. The treatment is slightly different, because if you deal with the TMJ joint, either you inject steroids in there, or you use certain other medication, or you even have surgery to correct the TMJ disorder, the headaches go away. So I'm not sure what the person is asking, but TMJ disorders are quite distinct. And that's where taking a good history of getting some questions asked, very important. We ask you things like, what brings on the headache? Sometimes with TMJ disorders, chewing or eating is often a precipitating factor. Unlike migraines and tension headaches, they don't just happen on their own. There has to be something that's causing it and all of that. And you can see it in very young people. I have a 19-year-old patient who, unfortunately, his dentition is slightly different. So he's going to need surgery. But once he has corrective surgery, things should be fine. So I like to be a master of all trade, but the owner of none. So my job as a general practitioner is to know a little bit about everything. But I have seen some of that, and it's actually easily treated. Let me be bold to say, except in one or two cases, because I had a 45-year-old lady with really bad TMJ disorder. They are not as debilitating as tension headaches or migraines. People who have really bad migraines, they suffer a lot. They lose time at work. They're off, relationships have been ruined from migraines because of how bad it is. You're not able to function. You can't go to school, you can't go to work, you can't go to parties, you can't stand flashing lights. So for a lot of people, these are serious things that affect their everyday life. I hope that makes sense.
No, definitely. Thank you so much. And another question just about migraines and headaches, about the genetic factor. Are they hereditary?
Like I pointed out in my, thank you, that's a good question. So migraines are the only ones that are known to run in families. They genetic predisposition to. There is no direct inheritance link, but migraines tend to run in families as opposed to tension headache. Tension headaches are often triggered by psychological factors. Like I said jokingly, Man United not winning, the weather is too hot, I'm stressed out, the cat is making too much noise. All those things can give you a tension headache. Not so migraines. Migraines are often, to the running families, it's inherited. You will see generations. Grandmother has it, mother has it, mom has it, then her daughter has it, and that tends to be the case there. And so the aim of that is to manage it rather than trying to cure it.
Great, thank you so much. So someone's commented that they often get nosebleeds, probably every few weeks, and headaches, and they just happen without warning, and then starts to get palpitations, and then this settles. And they've just said, is this something that they need to be concerned about? And it's going on for a few months now. And I'm giving a disclaimer here, Dr. Joe, because it's just really feeding into the fact that we're here to give advice and education, but not kind of one-to-one medical care. But if there are red flags, which you've mentioned about, you encourage follow-up. So I'll hand that over to you, but just giving that broader disclaimer.
Yeah, thank you for that, sir. So like you rightly said, this is not a clinic for us to, we can make it into one. If there's a demand for it, we can have a session where you bring your issues, and we bring We have lovely consultants. I have friends, pediatricians, neurologists who can come and answer your questions. But that's not what this health hour is for. This particular case, depending on how old you are, I don't know who's asking the question, but if you're having nosebleeds and headaches, and I can't remember the third symptom you mentioned, but I think you really need to get it checked out. You need to go to your doctors. That could be a sign of high blood pressure. So hypertension is one of those things that can give you headaches. Actually, having headaches and high blood pressure is a late sign. By the time you start having headaches, it means you had a high blood pressure for quite a while. Because hypertension in typical fashion is known as the silent killer. It doesn't give you any symptoms. By the time you begin to have symptoms with your hypertension. Now, let me just say this. A lot of my Asian and African patients come in and say, please, can you check my blood pressure? I'm not feeling very well. Now, I don't know why we think everything is related to blood pressure, because if you're not feeling very well and there's a blood pressure problem, very often you won't have any symptoms. If you really have high blood pressure, you won't have any symptoms. By the time you begin to experience symptoms from blood pressure, that means it's either very serious or it's been going on for a while. So if you're having nosebleeds, like I said, I worked in ENT, please get it seen sooner rather than later. And I will stop there because nosebleeds are things that are emergencies. While we're on this subject, Vanessa, if you permit me, there are certain, I forgot to include this in my slides, and I think I mentioned it in passing, but it bears repeating. There are certain red flags that we consider for you to look out for with headaches. Number one, like I said, a persisting headache, a headache that doesn't go away with simple painkillers. If it goes on for 4 to 6 weeks, please get it checked out. Number two, thunderclap headache, a sudden onset headache that's the worst kind of headache you've ever had. Number three, any kind of visual symptoms, blurred vision, double vision, etc., or loss of vision. Now, in some cases, you can have hemiplegic migraines that cause loss of vision. But we won't know that until we've done an MRI scan to determine that. It could well be a stroke. It could be retinal detachment that's causing your loss of vision. So you see, there's a lot of things. It could be a bleed in your brain. So these are all red flags to look out for with headaches. Vomiting is often a bad sign. Projectile consistent vomiting for no reason. Neck stiffness, a rash, high temperatures above 40 degrees, and headaches. These are all red flags for dangerous forms of headaches, because it could be meningitis, it could be a brain tumor, it could be a few other things. So I think it bears repeating that.
Thank you, Dr. Joe. I think, yes, definitely. A huge part of why we're here is to get people to seek help early, sooner rather than later, as appropriate. So no, that's fantastic. And there's other things about toothaches and migraines, and I think it relates to what you were saying about the TMJ pain and why toothache pain can kind of radiate upwards and things like that. I don't know if you want to say anything else about that, or you've kind of exhausted that aspect.
Well, it's for me, actually, it's actually quite simple. Why I say that is because when someone comes into my consulting room, by the time I've asked you 5 or 6 questions, even if I don't see you physically, I can determine whether it's a TMJ problem, whether it's a dental problem, or whether it's something else, very often. So when I teach with medical students, 80% of making the diagnosis is from the questions that we ask you. So really, you need to go to the right place to get the right information. Once you give the practitioner the right information, it points us in the right direction. This is why I was saying earlier on that sometimes patients or people don't know what to say to their doctors. Just tell your doctor exactly how you're feeling. Stick to the facts, because in this particular case, it is absolutely crucial that we are able to delineate and distinguish between one type of headache, one type of condition from another, because the wrong information begins to lead us in the wrong direction. So if you have a case with TMJ problems or with dental problems, it's very distinguishable. Once with TMJ problems, one of the characteristics is opening of the mouth, for example, often triggers off the pain. That doesn't happen with migraines very often. You don't get that with migraines. You won't get that with tension headaches. Chewing or mastication can cause headaches. So you can see moving the head or the neck in a particular way with TMJ disorders, and with that there are certain things that we look out for that will help us to be able to know in what direction to travel.
Great, thank you so much. And just to everyone listening, thank you so much for your questions. I'm collating them, so if you feel I'm not getting to yours, I am. It's coming. And if you feel that you want to ask your question directly, please feel free to do that. Someone again has really offered their personal experience again. And I think whilst recognizing the disclaimer that we said earlier, one of the great things about this session is that we do share about our different experiences and what, so that others may learn at home and get the right help that they need. So someone has said that they suffer from hemiplegic migraines. I think it may be worth talking about specifically what those are again, but also for this person in particular, these seem to be getting worse and has been really quite debilitated by them for the past couple of weeks and months, and asked treatment options, commenting that no medication has worked so far.
That's interesting. When I get that, the first question I ask is, what medications have you had so far? And maybe the patient is right, but the truth of the matter is most people that I see haven't tried all the different medications in our arsenal. There are at least, from the top of my head, 8 types of medication that can be used for hemiplegic migraines, just from the top of my head. So there are many things that can be used, and also lifestyle changes that can be advised that will help with that. The issue is to go back and speak to your health practitioner. Sometimes you may need to speak to a neurologist. We may need to refer you to a neurologist who has a special interest in headaches to be able to deal with that, because there are some people with complex problems. For hemiplegic migraines are not your classical type of migraine. They're a little bit more serious and a little bit more tricky to deal with. But once you get the right treatment for it, it tends to work much better.
Thank you. Next question is ear pain and pressure in the ears. And just, I think, as ever, when you listen to things like this, you think, oh, actually, could this be the cause of my symptoms? So someone has said that they often get pressure in their ears most days, and that gives them some headaches as well. Could this be tension headaches?
It's possible, yes, but it's very likely that they need to have their ears looked at, because buildup of wax can give you pressure in your ears. Otitis media, fluid in the inner ear, in the middle ear, can give you the same thing. So if you're a swimmer, if you're a smoker, or you hang around smokers, you can get that buildup of pressure in your ears. You can have chronic otitis media, for example, that gives you pressure in your ears. And that can then translate to, so headaches from there are often what we call referred pain, like you get in other parts of the body. It's just like the TMJ person. The pain around there can be referred to here, to parts of the face and the head, which presents like a headache. So this person, my money is that you may well have an ear or even sinus problem. I wanted to talk about sinus problems, but there wasn't enough time. This is hay fever season. Many people are going to get blocked noses, blocked ears as a result of hay fever. For many of you, that will also then translate to having a headache. That does not mean you have a tension headache. That does not mean you have a migraine. Once you deal with the underlying hay fever, once you deal with the sinuses being cleared, and that person with pressure in the ears may well have a sinus problem, then the headaches will disappear. So get it checked out and speak to, for a small fee, Vanessa and I will see you privately. Usually I accept carrot cake payments or Ghanaian jollof rice.
Love it, Dr. Joe. And someone has another great question, just asking you to emphasize, because I think you did mention it, about the importance of water and really reducing the probability, particularly in this warm weather as we're heading to 30 degrees in part of the country, and we're not always used to dealing with that. And really, I think a really good practical question, how much do we need to drink to avoid headaches?
That's a really good question.
Water? Isn't it really good? Because we often just say take water, but how much, particularly in this weather? And also, is it just water or any other fluids as well?
Very good question. This is the kind of question I like to answer. Okay, so on the average, let me break it down. Women or ladies have 70%, their body is made up of 70% water. So inevitably, you need to drink more water sometimes. With men, our body is made up of 60 to 65%, less than the ladies. Now, in the UK, in the winter or in colder weather, you need somewhere between 2 liters of water every day, all right? 2.5 to 3 liters every day, no more than that. If you're in warmer weather, like in the summer, or you go to a warmer climate, Portugal, Spain, etc., that increases dramatically to between 3 to 4 liters every day. Now, the caveat is that if you are someone who exercises a lot, if you're someone who sweats a lot, if you're someone who's very active, then you need to add another 0.5 liter to that, whatever weather you're in. So basically the starting point is we shouldn't be drinking less than 2 liters of water every day. Now, in terms of fluids, there are certain types of fluids that can add to your water intake, fruit juices, your smoothies, tea, etc. But we have to be careful with caffeine-containing foods because some of them can actually cause you to be dehydrated internally, even though you're drinking a liquid. But there's a complex thing going on there where your body cannot absorb all the water because of the imbalance in the salt content. All right. So when we're talking about fluids, because not many of us will drink enough coffee or tea or juice, well, except you are like one of my children who drinks juice for a living. But generally we advocate 2 to 3 liters of water. In the warmer weather, add 1 liter to that. And I think that's really sort of the caveat. So most of us are not drinking enough. That's the truth. We need to drink just by drinking water and exercising. So regular 2 to 3 times a week, 30 minutes exercise. It will dramatically reduce your risk of having headaches. Now, somebody has put in a question which I feel is related to this. How important is the role of stress management in headaches?
Exactly, yeah.
So in terms of, it's absolutely crucial because for both headaches, tension headaches, migraine headaches, if you look at my little slide that I put up there, both of them are important in the development of both. For tension headaches, stress is more of a factor. So it's important rather that we try and manage stress. And we've had a conversation. I did a couple of sessions here on stress and stress management. So we won't be able to go into that. You can dig into the archives, but it is a really good question. It's very important. Somebody has said that, will the doctor accept Nigerian jollof rice, which is obviously better? Well, the jury is out.
I was waiting for that. I was waiting for that.
I'm Nigerian, so I grew up on Nigerian jollof rice, but there are some Ghanaian jollof rice that you have. I guarantee you, it will make you taller. It will make you think clearer. You will have a better outlook towards life. I'm just saying, so.
Just saying, no partiality here.
No partiality, no pressure there.
Yeah. No, definitely. Thank you so much. And please keep your questions coming in. Just one that just a couple that I've just received privately. So someone's just talking about headaches in kids. And so they noted that their teenagers were starting to experience some more headaches, and it wasn't really an issue as a child. So just trying to talk about age and headaches, please.
Well, this is a really good question. So like I alluded to in my presentation, you can have headaches in children, which you can have migraines rather developing in children, which is often migraine type headache. It doesn't mean children don't get tension headaches, because they do as well. The challenge is to distinguish between tension headaches, migraines, and other forms of headaches like sinus headaches, ear infections, TMJs, and all of that. Your doctor should be able to help you with that. Now, headaches in children are absolutely crucial that we deal with it and look into it on time. Again, the message here is that it needs to be looked at sooner rather than later. So dehydration, iron deficiency, low iron, I have seen often is a factor in causing headaches in children. So if your teenager is often having headaches, look at their sleep-wake balance. If they stay up late, if they're always up late, etc., that could be a factor that is responsible for the headaches. So that could be a stress type or tension type headache. But it could also be that they suffer with migraine. So again, there has to be a process of elimination. And so when you've ruled out diet, exercise, iron deficiency, sinus problems, ear infections, things like that, you have to then begin to go on to, well, this is why I said, for me, we have to have a low threshold for dealing with headaches. In other words, if you have a headache that's persisting 4 to 6 weeks, especially in children, please get them checked out sooner rather than later.
Thank you so much. Another question that has come through, which I was surprised because I thought it was going to come up a bit earlier, was about menstrual migraines and the hormonal impact.
Yeah. I didn't want to go into that because that's a whole different ballgame. I deliberately avoided that. The reason why I didn't is because anything that we do here, I want us to be able to do justice to that subject. So if you notice, you picked up on this, Vanessa, I just tried to do a broad overview of headache because we could go into migraines and start talking about hemiplegic migraines, migraine with aura, migraine without aura, optical migraines, abdominal migraines. You get that in children, actually. So you have abdominal migraines where they're having migraines, but it's a tummy pain. And that's what one of the things I wanted to mention with the previous question, where you have tummy aches, but they're actually a form of migraine. So with regards to migraines or headaches and menses, you have certain types of headaches that occur around the period, so it could be as a result of premenstrual tension, or it could be as a result of hormonal cause of migraine. So again, that needs to be looked at separately. We need to look at what medication you're on, whether it's the pill, and if it's the pill. If you're getting headaches and you're on the oral combined contraceptive pill, please see your doctor that sooner rather than later, because you may not need to be on that pill. You may need to change to a different medication. I won't say more because we won't be able to exhaust and sort of deal with that properly.
Completely agree, and I think as ever you've given the salient things there of when people need to review the medications that they're on, and also speak to their doctor as well with more detail about their symptoms. So thank you. And again, just a couple more. I'm always aware of time, so we'll just slip in one or two, and then hand over to our colleagues at CAHN. And just to note as well, Dr. Joe, so the lady that talked about the hemiplegic migraine, just giving some acknowledgement that she'll go back to the GP, also waiting for a specialist, but really appreciates your comments. So thank you so much. And actually, this question that's just come up on here is a similar one that's from someone else privately. So they've talked about if someone has intermittent headaches at the front or the top of their head and can't see what triggers it, how can one rule out anything like a brain tumor? And I know you commented on this previously about people's concerns about tumors, and the other person that has contacted me directly comments about just an ongoing fear that they're taking their regular tension headaches for granted, and the headaches go with paracetamol and ibuprofen, but they have been going on for a long time. So it's just that, that anxiety about, are they missing something?
Yeah, that's a really good, it's, I think it's a relevant question. I think it's an important one. The truth of the matter is that if you have a headache that's severe enough to cause you concern, consistent enough to disrupt your day-to-day activities, or indeed persisting long enough to be like, this has been going on for this time, I would advise you to go to your doctors and get a brain scan. That's the only way we can really know whether you've got a brain tumor or not. And we've seen people as young as 27 developing pituitary tumors, like I alluded to in my presentation. I don't know if I spoke quite too quickly, but these are all real patients that I've seen. Some of them have had very good outcome, because I still believe that the NHS is one of the best healthcare systems in the world. That's my personal opinion. But some of them, unfortunately, didn't have such a great outcome. But I think early intervention and, stepping in quickly enough. I'll give you a typical example. I have a lady who's 24. She suffers with anxiety and depression. She's very anxious. She harassed me 2 or 3 times. Oh, I want a brain scan. I want a brain scan. These headaches are definitely caused. And I told her, look, from what you've described, it doesn't sound like a brain scan. It doesn't sound like a brain tumor, rather. Well, we got her a brain scan and everything was fine. And so then she said, oh, so why am I getting these headaches then? So I said, well, if you had listened to me the first time, these are the different types of headaches. So only my mother does everything that I tell her to do. I appreciate that people will have different opinions, and I understand that people will have concerns. So, but do speak to your GPs. If the headache is going on and on, even we as healthcare professionals, we want to get to the bottom of your headache. So one of the things that we can do is to organize a brain scan. And that's the only way really we can rule out a brain tumor. Like I said, if you've got a headache that has been persisting beyond 4 to 6 weeks, I think I'm sounding like a broken record now, and it's enough to cause you to lose time from school or work, etc. It's severe enough to warrant you having to take a lot of painkillers. Please get it checked out sooner rather than later.
Dr. Joe, thank you. And I think it's really great that you're sounding like a broken record, because often this is why we're doing shows like this, is people don't feel empowered to go and ask for more, to, challenge in a positive way and question and get justification. So I think the broken record is much appreciated, because it just gives people the confidence to go back and challenge and explore with their clinician, and it not to be a two-way relationship rather than one way. Dr. Joe, as ever, you've imparted your knowledge. You spent so much time with us, and we say a huge thank you. And we say a huge thank you to all those that have been listening with us and engaging. It always makes it so pleasurable on my Saturday mornings when I'm hosting, because it's the interaction, learning and the interaction, which is fantastic. So thank you so much. So now I'm just going to pass on to my colleague in CAHN, Laurenti, who's going to give us some adverts and just some announcements for the coming week ahead. So again, thank you to everyone. We don't take your time lightly, and it's been a huge pleasure. Dr. Joe, thank you so much, as always.
That's great. Thank you. Oh, thank you, Dr. Joe, for a fabulous presentation. It was enlightening and very informative. And thank you to our fantastic host, Dr. Vanessa. It's been fantastic. And thank you to all our attendees on Zoom, Facebook and YouTube. If you would like to access any of our health hour sessions, you can find them on our YouTube channel. And please do complete the evaluation link if you haven't already done so, because it would be great to receive your feedback and ideas. So I'm just going to share some upcoming events with you. Please do pop them in your diary and share them with your family and friends. So our next CATHIP Health Hour session will take place again next week, same time, same place. So please do tune in to benefit from the expertise of our fantastic Black doctors. So it will be the 17th of June, 17th of June, and the topic is navigating dental services. And our guest speaker will be Dr. Michael. And to register, you can email health@CAHN.org.uk. Next slide, please. Taking care of your health starts with your diet and physical activity. So please do join our Healthy Hearts session. Again, it's on Tuesday, 13th of June, our next session, and it's 6 o'clock in the evening till 7:30. Same time, same place as usual. And it's Dr. Fakumbo, and the host will be Dr. Bar, and physical instructor is Orlando, as usual. So please do register by email at events@CAHN.org.uk. Next slide, please. Our next family and advocacy session is happening on the 14th of June via Zoom, and the topic will be supporting your child with special educational needs and disabilities. Our guest speaker is Abigail, and our educational psychologist with the One Education, and that's Abigail and Audrey. So please do join us, and for any support or any further information, please email advocacy@CAHN.org.uk. Next slide, please. So are you affected by the current cost of living? If you are, we would like to know how you're coping. Please do take part in our survey. There is a QR code that you can use, or please email research@CAHN.org.uk or between 10 AM and 4 PM, and every Wednesday at Mosside Leisure Centre. So it's between 10 and 1. And for further information, please email orlando@paulclub@CAHN.org.uk. An important event, our Windrush 75 celebration, and it would be great to have you all there. And it will be at the Alexandra Park in Manchester on Saturday the 24th of June, and it will be between 12 and 6 PM. And there will be stalls, Caribbean food, traditional dance and costumes, Caribbean old time and contemporary music, sports, Windrush Walk, and many, many more activities going on. So for further information, please email windrush75@CAHN.org.uk, and hopefully see you there. Next slide, please. So I'd just like to say a special thank you to all our CATHIP partners. Do contact the service in your area for further information if required. So it's CAHN, Caribbean African Health Network, next slide please, Enfield Caribbean Association, RAFA International Development Agency, the Royal Assembly Redeemed Christian Church of God, Croydon BME Forum, Black Health Initiative, and that's it for. Thank you very much, and thanks to our guest speaker again, Dr. Joe, and our host, Dr. Vanessa, and everyone for joining us today. Do enjoy the rest of your day, enjoy the sun and the football if you're watching it, and do keep hydrated. And I'll hand you back over now to the comms team. Thank you.
Bye.
Bye.
Hello, everyone. Good afternoon. Just wanted to apologize for any disturbance caused. We will do our best in our next sessions for this to not happen. But as you know, our links are online, and unfortunately, there will be always people trying to disrupt great work like the one that we are doing here. Again, apologies, and I hope to see you all next week.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our Health Hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.